So hello fellow Earthlings. This is Earthling 6455463728. And I wanted to talk about Joe Rogan's recent podcast, a second podcast with Peter Hotez. This podcast really was not quite as interesting as the first one. I think I might be conflating, because I saw one by Mr. Osterholm, which is someone that Peter Hotez knows. And then subsequently I went and looked at Peter Hotez's the podcast with him on it that Joe Rogan had. This one was not as informative as either one of those other podcasts were. To me, the thing that really stood out the most in this podcast was the fact that we're in the middle of this thing and there's so many things that are unknown. One thing that stood out to me again, though, was, now that I think about it, is that Mr. Hotez was saying that, people who are healthy, based on the Chinese data, they would have initially thought that healthy people who are under the age of 40 would not have been very acutely stricken by the disease. And I think that Mr. Hotez came to the podcast with the news that, hey, this appears to be just based on what they saw in China, and it might not apply to what is in the US. But I think that it bears consideration that a lot of people in China are not they're not overweight or obese. That is something that is much more common in the US, and it's something that I had seen that we should see or look out more for, that there would be more quote-unquote healthy people who are overweight or obese who would die from, or get at least severe complications, who had no pre-existing conditions beyond that, who would be affected by COVID-19. So to me, I think, and this is something that I spoke to other people about, and I think people are, it's our modern understanding that these people are healthy, but based on medical, what we know from medicine, obesity is the second worst thing that you can do to yourself outside of smoking. So it's not a shock that people who modern Americans might not think of as being unhealthy might get hit by this, because sure, we have changed our ideas of what is overweight or fat or unhealthy, but it doesn't mean that science has. It doesn't mean that these diseases have. So I think that was one thing that really stood out to me, that we're going to be calling a lot of people healthy. Now this bit is outside of the podcast, but it seems that a lot of people who are dying now, and very likely COVID victims, are not being counted. That is happening in the US, and it's also happening surprisingly in Italy as well. I just remember I read an article where 24 out of 36 patients at a nursing home in Italy died, and they were not recorded, died within the last 2 weeks, month, or whatever, and they weren't recorded as being victims of the disease. And to me, it's shocking to go back and look and see that this is happening in Italy, but wow. And I think a lot of things as well will happen in similar things are happening apparently in the US, where they don't have enough tests, and one of these healthy people, his wife had to fight to get him tested because he was 39, and he came out as having the disease and needing hospitalization, and he just died anyway. And that was the last time that she saw him, she said. because she dropped him off and she went in, tried to get into the hospital, and they said the hospital was locked down, and that was it. She didn't see him again. That is awful. And aside from that, I'm thinking that this is something that will be increasingly common, as if it is that the disease can survive, the transmission can survive on surfaces for lengths of time, then it's probably likely the same case with respect to bodies. And people may not get to see, as somebody pointed out to me, they may not get to see their loved ones before they are either cremated or interred. So that is, wow, crazy. Anyway, with respect to Dr. Hotez, one of the things that jumped out at me is that he said, and he had been alluding to the fact that he felt so much, he empathized so much with healthcare professionals, and he said that repeatedly, and that was something that was causing him stress. And I didn't really understand until he finally revealed that some of his students who were in the healthcare field industry, they came to him and they asked him where they should go, and he advised them to go to New York. I presume as he had done, because there were so many opportunities there. And obviously, as we know, New York is the epicenter for the disease right now. So he's feeling a lot of, as he was explaining, a lot of guilt, even though he knows that there's no way that you can know in advance how things are going to turn out. And, I remember when I was they were going to flunk out of a class, so they decided, hey, let me drop this class when I was in undergrad. And I was like, no, stay in the class. And I was not intimate with them or their skills or what was happening in the class. And at the end of the semester, I asked them, what happened? And they said, well, they flunked the class, and it was threatening their scholarship. And I just thought of all the horrible words that could have come out of my mouth. When they wanted to drop the class, I was discouraging them from dropping the class. And I was just thinking, oh my God, I could be responsible for this guy. I mean, ultimately it's his decision, but I don't see it like that so I can sympathize or empathize with Dr. Hotez in terms of having some words come out of your mouth that would have encouraged or led to somebody making a decision that turns out poorly for them. And even though you know that there was no way of knowing, then I guess I should have shut my mouth, maybe. So, and not, it makes you feel like not ever advising anybody about anything again. And, I thought it was a lot easier that I'd gotten over that idea until I just thought about this again. So I guess I can really empathize with where the doctor is coming from. Unfortunately, there were some things that he didn't get to that I really wish he had been able to, even though Joe Rogan tried to press him for it. For example, the malaria drug that had somebody had died of taking it. I wanted him to answer specifically to his understanding, and we know that he would not be 100% cognizant of every detail of that case, or even most of the details of the case. But I would have wanted to know. I really wanted to know if what he thinks happened. I guess Joe had to really he had to fill in the blanks, in that apparently there are different types of this drug, or there are substances that can also contain the drug that might be poisonous, whereas the medically given substance is supposed to be somewhat safe. Now, I don't know which side of it I sit on, because Dr. Hotez was saying, at least in terms of his answer to Joe, which again I would have wanted more details of the case where the person died, but he was saying that he didn't think that it probably would work, because this was something that they had tried with respect to influenza, and it seemed to work when they were testing it in vitro in a petri dish. But basically, when they tried it outside of that, in humans, it didn't work. The idea seems to be that this particular malaria drug prevents the virus, or reduces the likelihood of the virus being able to enter cells. And obviously that would reduce infections, or probably just end infections altogether. But I think that given that it did not work for influenza, that is probably, Peter Hotez is probably correct, that is not going to end up working for the coronavirus. And he was saying that he knew the guy who was testing and who had gotten the results, but they needed a bigger study, and he respected the guy, but he was not too, he wasn't really believing that it was going to end up being useful, seeing as it already didn't work in another case. So there was that. And he mentioned, Joe was asking him about his health and how his health was doing, whether he'd stopped eating junk food, or if, for example, there was any advice that they were giving out to people to try to boost their immune system. And on the one hand, he seems to have lost some weight, but it seems more out of the guilt of suggesting New York to his students, and his schedule, trying to be on every show to be able to give as much good information as possible, whether it's Fox News or CNBC or CNN or wherever it was. He wanted to be on as many shows as possible to give out good information to people, and as a result of that, it messed with his schedule. And even when he went to sleep, he was waking up somewhat upset and distraught and worried about these students, I guess, that he had sent into harm's way. So that, but, and I already know from my life, it is really, really difficult to change anybody. Unfortunately, it's more likely that people are going to die from a particular thing rather than being changed because of the effects of something happening. It's like trying to get an alcoholic to stop drinking. Yes, you're gonna meet those alcoholics who were able to stop drinking at 100%, but that's not something that you could bet on. I think it's something less than 20-something% of alcoholics give up alcohol, like period, or for any long period of time. And when I was looking at it, it was some study comparing alcohol anonymous to some other means of getting over substance abuse, and there's a really low number of people. So between smoking and drinking and poor exercise and poor sleep habits and all of these other things that reduce people's immunocapacity, their immune system's capacity to defeat a disease, I think wherever, it's like musical chairs. When the music goes off, wherever you are, that's where you're going to end up being. It's not like you can really get people to change that much. Even young people, teenagers, you have to have really special conditions, and that's something that I would like to see, if they would do a study on that, or if I could find the studies that have been done on that. How do you get people to change? Because even for myself, I know it's really difficult to quit smoking, and it's really difficult to lose weight, and it's really difficult to maintain weight, and all of these other things, and to try to sleep more. It's hard to change. So the cards are where they are, and we have to see how they turn out. They didn't mention it, but I really wonder what's going to happen when people are out of money in the US, when they can't find jobs and the economy is that bad. What people are going to do when they don't have their money for food, and there's nothing in place to be able to give out this mass amounts of food that people are going to need to survive when they can't find work because the economy is horrible and the disease is coming back. This is going to be crazy. Anyway, guys, wish me lucks. You can like or unlike. You can comment, subscribe, and or share. Peace.